Hi, good evening, everybody. And I'm so sorry for the technical glitches. And I'm so sorry once again for being late for this talk show, but we were having some major technical glitch and I just couldn't log in. So apologies from my side. And it gives me great pleasure to say a warm good evening to each and every one of you out there. Each and every aspect of your entire connect with your how you would respond to your weight loss journey. And today it gives me great pleasure to be a part of this fantastic meeting where we are going to actually learn so so it's a great pleasure to listen to the key updates on obesity. Over to the tech team. Can we have the obesity updates, please? Now, when you talk about the obesity updates, friends,
Ma'am, your screen got freeze, ma'am.
can you see me? Can you hear me, Faraz?
Yes, I
I'm
can
so
hear you,
sorry,
ma'am.
Dr.
Ma'am, you
Raju.
can start
Yeah,
the discussion, ma'am. I think, ma'am, like we are all like, if you face
okay.
the difficulty, you can turn off your video, ma'am.
I'll turn off the video for us because I think I'm facing some technical glitch. So I'm Sir, I'm so sorry. Apologies for this. But I think I'll just continue being offline, and it gives me, I mean, sorry, continue being without the video. And it gives me great pleasure to introduce Dr. Raju Singh China, who is an absolute, I mean, I would say, doyen as far as his field is concerned. He's
I'm not able to hear anything from Dr. Sheikh's side.
so. Can you hear me now?
Yeah, you just get offline after about two lines, but we can
Okay.
continue. Yeah, it's much better now. I hope the
So, it,
31D Atlas is not passing nearby or stratosphere.
so I don't know why this is happening today, to be honest, because the routers
Yeah,
is. But I'm just a bad day, I guess. So I'll just get
yeah,
directly to the question, and then at least the audience can hear you. So I
बिल्कुल
just
ठीक है.
have one very important question for you. The first question. So, what is the
Mhm.
gut microbiome, and why is it in the news now?
I will give you a very brief background into it. Number one, I'm a gastroenterologist. Number two, I happen to be the vice president of the Nutritional Society of India. Number three, I was just recently, till recently, the president of the GI Infection Society of India and gave a talk about a month ago on microbiota and MFLD. MFLD is liver disease associated with fat and metabolism. The level of interest people are generating in the microbiota these days is immense. It is immense because the number of microbiota we have is about 10 to 100 million. And if we see, trillion, sorry, and if we see the total amount of weight the bacteria has in a human body, it's almost approximately to the tune of 2.2 pounds. That means almost 1.5 kgs of bacteria a 60 kg person is having. And then they are genetically living organisms. So just imagine that three times the number of cells which you have in your human body are residing in the gut, and they are living organisms. And as was previously thought till almost a few decades ago, they are, that they are just passive passengers in our journey of life. It is not true. Now, people have started realizing that they are living organisms. They have a living interaction with most of the things, whether it is an inflammatory thing, whether it's an immunological thing, whether it is a psychological thing, whether it is to the tune of your nutrition and things like that. So all these, it is not only the bacteria. The number of viruses is three times the number of bacteria. So you have fungi, you have archaea, you have these bacteria, and the interest is emerging because interplay between these organisms, the human body, and at multiple levels is happening. And um, I may tell you here that there's a lot of interest on microbiota and diabetes, a lot of interest on microbiota and MFLD, a lot of interest in MFL, microbiota and Parkinsonism, a lot of interest on psychiatric illnesses, a lot of interest is being generated these days on cancers, and obesity is only one part of the whole story. So this is what, in very brief, is the microbiota story. The microbiota is the organism, the theater which it interplays, whether it is immunological or inflammatory or it is due to hormonal changes, is called the microbiome. The totality, it is called a microbiome, and as individuals, they are called microbiota.
So when we talk about, I mean, thanks for that. So that was learning for me too. And so when we talk about the microbiota, I mean, so we always think in terms of, in the second breath, we say you hear about people talking about indigestion. You hear about people saying that, oh, my baby, my gut microbiome is not right. And that's the reason I'm having this. A lot of people, especially our people living with obesity, diabetes, all the time speak in terms of indigestion. So I mean, they say, I mean, there's a lot of evidence over that. Maybe it also influences metabolism to some extent. Okay, recently also there was some view that maybe diabetes is actually a gut microbiome modulated disease to a significant extent. So, what would your views be on this, sir?
I absolutely agree with you. What I think is the words of Newton once he said that we are at the edge of a sea and I am collecting pebble stones. The whole knowledge which is in front of me is still unexplored is absolutely true. We are just at the edge of the microbiota boom. I am very sure that we don't even know 1% of what is happening, what is the interaction of the different microbes with their own selves, microbes with our cells, microbes with viruses, microbes with fungi, and what is the relationship of various other ecosystem changes like what is the change of climate, why African has a different microbiota, Eskimo has a different microbiota, uh, American has a different microbiota, Japanese happens to have a different microbiota, maybe multiple factors, diet, social things, social customs, and all those things. But to put it straight, just saying that we have got a bloating and our stomach is not well is we will not blame it to the microbiota as such in such a easy manner, because there are multiple other reasons in diabetics and obese people where they get all these things. They can get it because of IBS, they can get it because of GERD. But one of the factors which will come up in the next few years is definitely going to be a microbiota related precision medicine, where I feel the AI, artificial intelligence, will go a long way, because it's very difficult to even remember the names. If you just remember the name, the Firmicutes and the Bacterioides are the bad ones, the Lactobacillus and the Saccharomyces are the good ones. So, two or four or six names you can remember. My wife happens to be the chief of microbiology, and she keeps on hammering these names. I have not been ever able to get these names. So, getting them even into your system is not as easy as it seems. But over a period of time, once personalized medicine is going to come up, and once precision medicine is going to come up, then precision nutrition is going to come up, and precision pharmacology is going to come up. With the help of AI, things will become a little easier in the long run. But this bloating, my stomach is not all right, and all those things, maybe a part is that which we don't know at the present moment. But there are multiple other reasons also in obese people and diabetics why they have their stomachs which are not good, or their tummy aches and things like that.
Thanks for that, Dr. China, because invariably when you are looking after people living with diabetes, everything is said to be now the panacea of everything seems to be a pre-probiotic. And everybody feels that okay, if you have a pre-probiotic, it's going to solve everything for you. I had one another very important question. We always, whenever we talk in terms of medication, people always feel that no, ma'am, we want to take something which is natural. We don't want to take any medication. There's in this entire emphasis on sticking more to nature-based foods. So, are there certain foods which can actually improve gut health and reduce weight also, or it is just a moderate diet which is the way forward? Or with so many diets nowadays, about binding, I mean, so many diets all over the place. Whether you talk about intermittent fasting, you talk about keto diets, you talk about paleo diets, we have. I really wonder. So, is there something as diet advice which you would possibly give our list to our listeners?
See, I totally, very good question you have raised, that what is that in diet you can do to make things better. The simple things are the best things. I still remember as a child, I had a poster on my table, and there was a big car there and a big castle like thing. And the caption was, my likes are very simple. I like to have the best. And the best things are the simplest things. What I'm trying to say is the best things, which are the things which nature has given you: foods, fruits, cereals. I am very happy that you raised this question. If you can see this, this is 30 ml of wheat grass, which is on my table, which I take. And this 30 ml of wheat grass has antioxidants, which are equivalent to almost 2.5 pounds of green leafy vegetables. How many people are doing that? Then, similarly, we have many other things like moringa plant, which can increase the fiber, and there are many other things which help once you take fruits and cereals and things like this, because they increase the microbial diversity. It promotes the short chain fatty acid production. It improves the satiety, because it is not only the fiber, you have the other fructose and things like that in the fruits which help. And at this stage, I must tell people, as a nutritionist also, that the ORAC value of a fruit juice is almost 5 times less than that of a fruit. So please, if you can take a whole fruit, if you can take a orange or a quinoa or मौसमी, प्लीज टेक दैट, रादर देन उसका जूस निकाल के बहुत खुश होइए और सोचिए कि हमने बहुत बड़ा काम कर दिया. The other important thing is these fresh fruits and vegetables have a lot of pigments which are very useful in the body system. On the other hand, if you take the processed foods, if you take the low fiber foods which the Western people have imposed on you and made us feel that this is the hep thing in doing, and then the sugary content beverages which have excess saturated fats, and these are the things which only give you calories, they are not giving you anything else. And in addition, they are also, I would not say destroying your microbiota, but changing your microbiota to a degree that it will harm you in the long run.
Thanks for clarity. Especially, I think it's very important when you say that have the fruit and don't have the juice. Because I think people always feel that if they're having the juice, it's fine. I mean, it's natural juice, so it really would not cause too much of trouble. And
Yeah,
that
the
I think
ORAC,
is
it is called the ORAC, ORAC value. The ORAC value of fruits is much better than that of juice. So, taking out juice and feeling very happy about it, that you have done a great job, may not be as great. But if somebody cannot eat fruit for lack of teeth or lack of any other thing, reason, then juice may be all right. But if you can take a whole fruit, it's always better.
no, totally accept. I think that's a very, very important message across to everybody, that please remember fruits are much better. Sir is having that lovely.
Yeah, I just had the wheat grass, 30 ml. It
Yeah,
is
he's
forced
having
on me
lovely
by
wheat
my
grass.
wife. Yeah.
It looked absolutely delicious, sir. Next time I come to Delhi, I'm going to come to your house and have
Sure,
that
sure.
too.
Welcome, 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 ma'am.
Thank you, sir. And sir, one more thing I wanted to ask you. There are lots of cravings. There's lots of, I mean, a lot of patients of ours complain about a lot of cravings. They say they just cannot. And now with the GLP-1 receptor analogs, which do affect these cravings, I mean, one very important question that keeps on cropping up, and we wonder is, are these cravings or overeating really linked to the gut bacteria, sir? Is that night craving, which you go to the fridge and try to sort of, forge whatever you have, is that somewhere connected to the microbiota, sir?
See, you're absolutely right. There is emerging evidence which says that these craving which you have for especially the sugars and other things is linked to the microbiota, in the sense that the microbiotas produce neuroactive compounds. They influence the dopamine and reward signaling. The inflammation may blunt the satiety cues also. So these microbiota modify this craving to a certain extent, but craving is also dependent upon your stress, your habits, your emotional level of state, your I would say food environments. So we must always be very clear that the microbiota is like the AI which we have. So it may only amplify the tendencies, but it does not change or dictate the behavior. That means If a person is very clear enough in his mind that he's not going to take it, then the microbiota cannot force him to go to the refrigerator and take out a glass of kheer or ice cream and take it. And then he blames it to the microbiota and says, "Oh, I never wanted to do it. The microbiota did it." So, microbiota only are, I would say, a little bit of an amplification for the whole process, but it is not the total process itself.
Thank you, sir. Thank you very much for that really fantastic understanding. I'm sure it's going to help each and every one of us. Sir, another very big query which always comes up is about antibiotics. I mean, the issue is always whether the antibiotics or the medicines you take, it may be anti-diabetics, it may be antibiotics. There's so many medicines which we are consuming. They have certain, I mean, and they also have certain excipients, which sometimes you wonder whether that's affecting the microbiota. We have medication that should be taken in a particular way. So much of, sir, for example, the pantoprazole, omeprazole, which is used all the time, so we sometimes used for years together, sir. And I really sometimes wonder what effect it has on the microbiota. People continue taking it, say, okay, ma'am, touch everything but don't touch this. I need it. I mean, without this I cannot sort of manage. So what do you think, what could be the effect on the microbiome?
See, you're very right, ma'am. Antibiotics have to be used where they have to be used. Unfortunately, in our country, and the over-the-counter sales of antibiotics, unaccounted sale of antibiotics, is leading on to a great problem. Even the Prime Minister was affront with this problem of antimicrobial resistance. And it is not only the antimicrobial resistance, you're changing the whole gut microbiota of a whole community. You are changing the uh, microbiota for uh, uh, the next series of people who are going to be born. So it is not as simple as we take it to be. Yes, wherever there is an infection, antibiotics have to be taken. But once you have a common cold and people give antibiotics, then they must remember that common cold gets okay if you treat it for a week, and it gets all right if you do not treat it for 7 days. So that is important. I think the doctors and people at large have to shun from the use of antibiotics, and antibiotics definitely alter the microbiota. After all, these are living organisms which we have, and once we take antibiotics for a specific reason, we also kill the good bacteria. We kill the things which is helping us. The second point was regarding the PPIs. I think PPIs are the more. I am a gastroenterologist. Every ICU, every hospital, I think 80%, if not 80%, at least 60% of the prescription pads or the prescriptions on the beds have a PPI, which is shameful, which is unwarranted, which is disgraceful, because PPIs are specific drugs and they have a lot of problems. They have a problem because PPIs knock off your acid, and your resistance against all these infectious diseases like typhoid, Shigella, Salmonella, gastroenteritis gets knocked off. Then they affect your kidneys, then they affect your bones, then they have long term effects which leads on to polyps and things like that. I see so many polyps on endoscopy thing. So my only submission is wherever it is necessary, you must take medicines. But people have started taking medicines like churan. They think it is something, a PPI is supposed to be there on your dining table, and you just pop in a PPI and you feel that your GERD has decreased. And this is another thing which is off the record slightly, but whenever people take PPI inconsistently, that means they take it for 2 days, then they leave it for 4 days, they increase their serum gastrin levels to a higher level than what was there earlier, and they do themselves more harm. If they have to take something SS, they should be taking antacid. So you are very right. Antibiotics discriminate use, and many other drugs which are being used are not good. There are certain drugs which might be helpful. For example, probiotic, prebiotics, metformin, and things like that. People have found them to be useful. But useful doesn't mean that you take a chemical to promote something which is of little negligible value. So I would say that whenever you have to take a drug, it has to be with a very clear intention, intention, and a clear focus and an aim, that what are you taking the drug for, and what are the side effects of the drugs which can come up.
I think what Sir is trying to very emphatically put over there is that whenever you think about a molecule, mentally you should always think about two very important things. One is the efficacy of the molecule. What is the indication? What is the clear cut indication you're using it for? The dose of the molecule, how long you plan to continue using the molecule, and the safety of the molecule. If you have these four things absolutely right as far as the molecule is concerned, you cannot possibly go wrong. And then what Sir's very important message is, you would use the right molecule in the right space for the right amount of time, so that potentially you would be able to reduce a lot of the gut, dysbiotic health issues which come up. Sir, I hope I've put
Absolutely.
it the way you would
Very
want to
good.
it to be put.
Yeah, this is exactly what it is needed.
Thank you. Thank you, sir. Thank you. Sir, is there some specific microbiome targeted treatment? I mean, is there something which you can do which specifically targets the microbiome, sir?
They are working on it. They are calling it precision probiotics. They are trying to find out certain microbes which might be very helpful. But at this stage, I would say that these are only experimental studies with a lot of a theoretical bias rather than of any practical utility at the moment. Maybe with what I was saying was, once we have a personalized medicine, our whole genome is mapped, our all microbiota, the 100 trillion of them are mapped, and their interactions are interplays are mapped, and the AI is able to take care of the things. Then they map up on a computer. They tell you that, okay, take this microbiota. This is going to be helpful to you. That is going to come up. People have tried even this. We do something which is called a fecal microbiota transplantation for people with colitis, IBD, and people have done it with lean fecal mass transplantation. And what they have found, especially in animal models, is that once lean mice were injected with the feces from um, obese mice, the lean mice also became obese because of the change in the microbiota. So these are things which are going to come up in future, but at the present time, I think it is experimental and more of theoretical at the moment. And this probiotics, prebiotics theory, curd is a beautiful curd, as I always say in all my lectures, curd and wheatgrass, if you are able to take, you do 90% of the job. So why do you want to go to capsules, and why do you want to go to, I call it, you should move from farm medicine, farm is PHARM, pharmacologist medicines, to farm medicine, FARM medicines. And we have most of the things available in nature, and we should be using more of it. It is less contaminated, it has lesser side effects, and it is, I think, much more, it will be much more useful to our human bodies in the long run.
Sir, that means most all of us are actually supposed to have have curd along with their diet. That would
Yeah,
simplify things to a significant
if you
extent.
take, yeah, if you take the Ayurvedic system of things, they said in the afternoon take curd with your food. And curd is supposed to be one of the better things. The only thing is, I tell people that if you have to have curd in shadi and all parties and all that, try to avoid curd wherever there is a addition to the curd of raita and bundi and things like that, because that is where the problem happens. That is where the contamination and bacterial overgrowth happens. But curd, as such, does not allow bacterial contamination. It has got an acidic environment.
Okay. That's really learning for me, sir. Okay. I mean, sir, how much do you? When you look at medicine, what I'm understanding from you, you have a very holistic approach to the human body. You believe that it's a lot of natural as well as, I mean, you need to go beyond your routine. You need to look at the human body in a much more holistic way than what we are doing now, sir. So do you think I mean, that's the way we should be moving forward?
See, I told you in the beginning that even Newton said, I am a very small person. And Newton was a very big man. And after all his inventions and everything, he said that I have just collected pebbles at the edge of a seashore. And the whole vast
Wow.
knowledge is in
Wow.
front of him. And he was absolutely, that's absolutely true. We
That's great
know
thinking,
very
sir.
little about ourselves, but we as allopaths have a tendency to overbloat our confidence to the degree that we know we don't even know anything about the universe.
Very
If you
true.
see
Very
the
true.
extent of the universe, you see where it is,
Very
where
true,
we
sir.
are, and then feel happy about it. I'll just give you a small example, this slightly off the track. This is your 70 to 80% of the human body is water. The allopaths give you allopaths, that means me also. I'm a DM in gastroenterology. We try to alleviate the problems through a chemical protocol. So for infectious diseases, we are good. For surgeries, we are very good. Most of the other diseases, non-communicable diseases, we are only able to control. We are not able to cure. We don't cure hypertension. We don't cure inflammatory bowel disease. We don't cure bronchial asthma. We don't almost cure epilepsy and things like that. What I'm trying to say is there are many other things which we don't know. There was a beautiful example on water done by a Japanese scientist about a few years ago. So what he did was he took a glass of water and they said prayers in front of it. There is Mario, his name was some Mario or something, and they froze the water. Then they saw the water under an electron microscope. The all water was systematically arranged. The whole water was systematically arranged. Then the same glass of water they kept, and in the room they had a lot of abuses and other things thrown in, and then froze it. Then saw it under a microscope. It was all bizarre. And people said, how is it possible? How has the prayer changed? How is the sound changed? How is your mind changed? So these are things which are beyond the realms of allopathic medicine at the present moment. But I am convinced that anything I read, went to Mayo Clinic way back about 20 years as a fellow, and it was written very clearly there. Anything which helps a human is worth trying. So whether it is music therapy, whether it is Ayurvedic therapy, whether it is homeopathic therapy, we should not just put things down disdainfully. If something helps, whether it is Tibetan medicine, whether it is anything, but we should have a little bit of scientific flow to it, prove it scientifically, and then go about it. There are many things which we are not sure of, and there are many things which I am convinced we have got it wrong from the Western people. For example, a simple thing like we all eat our food on a dining table. My mother used to tell me that they were pretty well off. They were in Nagpur and they used to sit in the kitchen and have food on a small mat. So sitting there meant that they ate fresh food. Sitting there meant that they had more bonding. Sitting there even made their joints more supple. And sitting there made sure that they never over went in terms of their weight management. You eat on a dining table and you can just keep on eating. So we have certain things which are happening, which are just happening because the Westerner people do it. And as a gastroenterologist, the typical example I give is of a flush seat. The Indian system of a flush seat was the most anatomically correct thing. We have done away with it. We have bought the Western thing, which we sit with your knees down and our hips up, and 30% of the IBS is due to that. So there are certain things which we need to be keeping our eyes open. Don't believe in superstitions. I would say don't believe in magic shows and voodoos. But certain things are there which you need to imbibe with your practice. If it helps you, please do it. If it doesn't help you, discard it.
Wow, so that was really a great, I mean, great learning. These are examples I think we will really remember for a long time to come. Really, thank you for that, sir. Thank you for, and I think that's very important when you said that all should have a scientific temper. You cannot afford to, these are not quack tales or stories. This, you need to always remember that also. Sir, I have a
Mhm.
very important question. Sir, do the microbiome differ in children and adolescents and adults, sir?
Yeah. Actually, I was just going through one of the very recent articles on microbiota and what is the course, what is happening worldwide. Now, it is the different stages of life, the child, how is the child born, whether he is premature, whether he is at a normal time, whether he gets breastfed, whether the environment is okay, whether his nutrition has been all right, will all determine. See, there are so many of these bacteria and they are fragile bacteria. They change, adapt, and probably they adapt better to changing things than our human body. This is what I feel. So it is not only the change in the lifestyle, in the life cycle, that means from a toddler, from a premature to infant to a toddler to a child to an adolescent, this will make a change. In addition, the other factors which will come up will be their social protocols, the roots, whether he's African or American or Asian, what food they are eating, then what vegetables they are eating, what pesticides and pollutants they are exposed to. We at the present moment don't even know that. At least I stay here in Ludhiana, and it is the AQI is 300. In Delhi, it is even worse, 500. That means people are inhaling 10 cigarettes a day without smoking. What is this? Is this a healthy sign? And people keep quiet and say that we have achieved so much, we have achieved that. I think this is something which we need to seriously be taking about. Even the air health, the water health, and your environmental health changes the way things are going to be. And in addition, you are absolutely right. Children will have a different microbiota, and as they progress into adulthood, their things will change.
Thank you very much, sir. Sir, I mean, in the interest of time, if I want to ask you one more last question, is that okay, sir?
Yeah, yeah, sure, please.
So, can we track? I mean, can we have some kind of tracker, or how can we improve our gut health? I mean, is there some way clinically or biochemically, or we can find out whether we are improving, not improving? Because this is so closely related to, especially obesity now. So we are increasingly talking about gut dysbiosis and the same breath as weight gain and obesity,
Yeah,
and with, I mean, it becoming an important parameter influencing obesity in a country where obesity looks like to be the next epidemic,
yeah,
and the
epidemic.
world where it possibly is affecting so many millions of billions of people. So how would you possibly improve that, and how could you translate in the obesity spectrum, sir?
Uh, Very good question. About 4 billion people by 2035 will have diabetes. I have a special interest in diabetes and fatty liver because 50% of these diabetics will have some sort of a liver disease. And so it is mandated these days that you must investigate all diabetics for get a fibroscan and get other liver parameters to rule out liver disease. The important thing is, can these things be minimized? Can these things be changed? Can these things be modified? Yes, absolutely, they can be modified. And it is a multifactorial thing. It is not eating a small pill which will change the microbiota. It will be changing your environment, changing the air around you, changing the water around you, changing the emotional quotient around you, changing your habits, getting into a more disciplined life, doing more exercise, sleeping more, all those things which our forefathers used to tell us. These are the things which is not rocket science. These are simple things, very simple things which they used to tell you. टाइम पर सो, टाइम पर उठो, खाना ऐसे खाओ, शाम को 2 बारी खाना खाते थे सारे पुराने लोग, अब 3-3 बारी खाते हैं, 4-4 बारी भी खाते हैं, और खाते ही जाते हैं, रुकते नहीं हैं. So there is nothing like this that if you eat something, you are going to become a superhuman. Your bugs are going to like it very much. I think if you keep it simple, We have a very beautiful the KISS technique in making a PowerPoint presentation, and it says keep it simple, silly. KISS, keep it simple, silly. Once you keep it simple, you be with your roots, you be with fruits, you be with cereals, you do not take a lot of sugars, you do not take a lot of processed foods. And I would still say this refrigerator is another one big thing which has come up in the hands of at least the urban people, even if their refrigerators are there in the rural areas now. We didn't have refrigerators earlier, and we didn't have excess of food, leftovers, and things like that. So all these things change. All these things, the bacteria they've changed. The bacteria, the interaction between the bacteria change. And if we take our fruits properly, if I take our diet properly, if we take a regulated exercise, sleep, all these things will change our microbiota, and they will help in the management of obesity. Obesity is not a single. You are endocrinologist. You know it is a multiple hit hypothesis for obesity. Microbiota is just one of them. The dietary things is another one. The insulin resistance is another one. Oxidative stress is another one. Then the genetic predisposition, very important. Environmental factors, very, very important. And these days, the inflammatory cytokines, which are coming up in a big way with this microbiota, is predisposing to diabetics and predisposing to obesity. So, it is a combination of factors. It is a combination of common sense, I would say. Common sense things, once combined, will give us better outcomes than very high sounded words like once we say, oh, we are going to have change the whole strategy from the bench to the bedside, have personalized medicine, which we are going to give you on precision nutrition, and then we are going to have the AI, which is going to come up and tell you what your microbiota are. These are high sounding words. These are good, nice to hear in lectures, but of very little utility in our world, in true real world. So I would say that keeping it simple, keeping sticking to our roots, doing things which our forefathers did for a very long time, may be a very good way to go about it. In addition, I feel if we people are doing yoga, and yoga means exercise to my mind, any exercise, whether you do the dance, you do a thandav, you do a bhangra, or you do anything. I still remember Professor Mohan's daughter giving a lecture in Hyderabad last month. So she has made a small video on thandav. Thandav is a intense, high intensity dance which they are teaching to people around, so that they do it even for 5-10 minutes a day, and they are happy with it. So these are the small little interventions we need to do, rather than if we have to go to the space, we have to start from the basics. We cannot just jump on the moon and say, hi Mars, how are you looking? So that doesn't happen. So we have to go slow, and we have to then take into consideration what is the need of the country. To my mind, the need of the country is simple, because a lot of people are not able to, even they cannot afford most of the things. Most of the people, they are not, they don't know most of the things. So jugaad, which is a Hindi word, which is a very important word, I would say, is needed. Jugaad is needed. Somebody has to come up with a new idea. Somebody has to, some endocrinologist, gastroenterologist, or nutritionist, or somebody has to come up with the idea that hey, there is a obesity epidemic going on in the country, and we don't need it. How do we go about it? And I'm very sure somebody will, some of the bright minds we have in the country, somebody will definitely come up with it. This is what my thoughts on it, sir.
So I think that's fantastic. I think that is really superb. And it was an absolutely great, great 1 hour learning from you. I enjoyed each and every minute, and it was, and sometimes I really realize how little you really know. I think it made me realize at the end of the day that how much more we have to learn in the entire, etopathogenesis of obesity, etopathogenesis of so many chronic diseases, and so much that so closely links the gut So conventionally, we never thought about the gut as being the harbinger of so many diseases, chronic diseases. We always looked at the gut as, simple gastro and things like that. So I'm so glad that so much more knowledge. We're moving so much away from what our conventional thinking was. And I'm sure with the knowledge that you've imparted today, sir, the simple things, be it your juices, be it your taking care of your gut in so many other ways. You pointed out specifically to sleeping right, reducing stress, reducing your screen time. You spoke about how simple things like yogurt make a very big difference. And finally, how important it is at the same time to be aware and use evidence based medicine. I think very important message, sir, you gave us. Use evidence based medicine to the best of our knowledge to improve the health of our country and hopefully be able to stem the obesity and the diabetes epidemic that we face. Thank you very, very much, sir. Apologies
Thank
again
you.
for all the technical glitches that I've had today. I'm so embarrassed about it and so apologetic about it.
I think
And a
once
very
you went,
big,
ma'am, but once you went off the screen, then things were all right. So
yeah,
maybe
they were.
you need to be on a bigger screen then.
Yes, there was some issue happening, sir, and I'm so apologetic about it. And a big apologies to the organizers also for having to, sort of live with this today. So sorry, and sorry to all the people who've logged in also to have to go through this. Thank you
Do
very
we
much,
have
sir.
any question answers from the audience?
Sir, I couldn't really see any question answers.
Okay.
For us, do we have any question answers?
Yes, ma'am. We have few some comments, ma'am, on the private chat. Like
Okay.
we can see some of the. It's a truly delightful to such a valuable guidance. Thank you so much from Dr. Bhupesh Sidana. Like few feedbacks are there.
Thank you, Dr. Bhupesh. Thank you very much. Faraz, if you can read those comments because I cannot read them, so I cannot see them on this. If you could read those comments, that would be really great.
Yes, ma'am, and we have received 7 likes. Amazing session and very important topic for discussion by Dr. Vishal Agnihotri. These are the feedback we have received. Over to you, ma'am. You can conclude this session.
Thank you, Faraz. Thanks a million. Thank you, sir. Dr.
Thank
Sina,
you, madam. It was nice interacting with you, and I hope some of the points which are made were off the cuff. But this is what I feel, and I speak from the heart more than my head. And I feel very strongly that once we try and give up the roots which our ancestors taught us for centuries, we end up with more problems than solving. So,
I'm totally
thank
on
you
the
so
same
much.
page, sir. Thank you. Thank you for that great learning. And thank you for speaking from your heart, sir. I think conversations which are from the heart always stay in the mind and they make a bigger impact than simply cerebral conversations. So I enjoyed speaking to you, listening to you speaking from the heart. Thank you very much, sir. Thank you.
Thank you, madam. Thank you.
Sir.